This material is made available to you by or on behalf of the University of Melbourne under Section 113P of the Copyright Act 1968. It may be subject to copyright. For more information, visit the University Copyright website.
Sophie Lin. Dr. Sophie Lin is a postdoc in my lab and part of the Cognitive Neuroscience Hub. She's developing the first wearable magnetoencephalography, or MEG, in Australia, and investigating decision-making using Bayesian framework. I know you'll hear about that in a second. Previously, she's worked as a research fellow under the supervision of Chris Smile at University of Birmingham and Gareth Barnes at University College London. There she applied wearable MEG to investigate learning signals in the human cerebellum. She did her PhD in computational neuroscience at Imperial College London, supervised by Aldo Faisal, where she used Bayesian decision theory and psychophysics to relate increased sensory motor uncertainty to a higher risk of fall incidence in older people. Not by coincidence, she's also a neurologist trained in Taiwan.
Thank you.
Thank you, Sophie.
Thank you, Marta, for the introduction. Very nice introduction. And thank you for the hub to give me the opportunity to talk about our research. So basically, in our lab, we are interested in how people make decisions under the ubiquitous uncertainty. Let's first take a live example, saying you want to make a judgment about the bounce locations of a tennis ball in a tennis court. So the Bayes rule will tell you you should use both your current image of the ball on the retina, so that's your likelihood, and also your statistical knowledge about the bounce locations, that's your prior knowledge, and combine them based on the reliability of each piece of information to make the best decision. So to test whether people truly behave in a Bayesian way in a laboratory setting, a classic task is called a coin task. So in a coin task, for every single trial, participants see scattered dots, which represent uncertain information about the locations of a hidden coin, and then they move the vertical bar, which is called a net, to the location where they think the hidden coin is, and then they receive the feedback information. So that hidden coin locations, over the course of the task, is basically sample from Gaussian distributions with different variance. And you can combine the uncertainty, the likelihood, and the prior with different variance arbitrarily. For each prior and likelihood combination, you can use the Bayes rule to calculate its optimal weighting that people should place on the likelihood information. And to measure how people truly behaved, you use the slope of the regression line between the chosen net locations and the centers of the likelihood. And indeed, in the past studies, the behavior finding shows that people truly behave, follow the predictions made by the Bayes model. Not only in the coin task, over the past 2 decades, in many studies, from perception, sensory motor control, to cognitions, we found that behaviors can be predicted very well by the Bayes model. But what we do not know is, given that behaviors are Bayesian, does the brain truly represent priors and likelihoods and use this information to make decisions? What I mean is, when people make decisions, are they truly doing this calculation that I mentioned in the first slide? So how do we address these questions? That's again start with a thought experiment, saying you train your participants with prior 1 together with prior likelihood 1, and then you also train them with a second prior 2, together with a second likelihood prior 2. Over time, their behaviors are Bayesian. Now, if you introduce the learned prior to pair with the newly never used likelihood to pair with them, so if people are truly Bayesian, we will expect over the course of learning, they already acquire the knowledge about the prior information. So they should become instantaneously optimal again, which means they will have successful knowledge transfer. But it is also possible, let's go back and look at a tennis court. It is also possible the way how they learn is they learn a policy mapping between the past sensory stimuli and the best decision and form the best policy without truly really have the prior information. In that case, when the scenario is changed, the pair likelihood is changed, they will have to learn everything from scratch again, which means they will have no knowledge transfer because they don't possess the prior knowledge. But past studies told us it is also possible it's something sitting in between the both extreme case. So what is possible is people might be using approximations of the posterior distribution to make the decisions, and during the learning course they behave very close to Bayes-optimal. And in that case, previously they were modeling study told us if that is the case, how well people can transfer knowledge depends on the likelihood that they introduce. If the likelihood is within the boundary of the past learning experience, the performance will be really close to Bayes-optimal. Once the newly introduced likelihood stepped outside the past experience, the performance deteriorates very quickly and sometimes even showing no transfer. So from this, you can already tell testing knowledge transfer is a much better way for you to discriminate whether people are truly using Bayesian strategies or not. And not only testing knowledge transfer matters, how you measure knowledge transfers also matters. So in the past, there were some few studies try to investigate whether people can transfer prior knowledge or not. The way how they measure successful transfer is defined by when you encounter a new combination, whether people are truly instantaneously Bayesian optimal or not. This has a problem. One of the things we actually do know over the past decades of studies, there were many behaviors were qualitatively Bayesian, but they were somehow slightly away from the predictions made by Bayes-optimal prediction. So that means when you measure a behavior in transfer condition and they are not Bayes-optimal, you might be seeing a mixing effect of imprecise prior likelihood estimation together with the use of a Bayesian or non-Bayesian strategy, which you just couldn't know because you can't tell in afar. So we propose try to use a very simple normalized measure, and let's go back to the coin task because that's the task we're going to use. So in the coin task, you can basically measure subjective likelihood by measure how precise people are when they estimate the centers of the likelihood information. And then, of course, you will also have the measure slope during the learning phase. With the two, you can calculate the subjective prior, which I'm not going to go into the two details. And with the subjective prior and the likelihood, which you are going to introduce in your transfer condition, you can calculate what a slope would be if they make perfect transfer. And then now you use the normalize, the measure slope change between the learning and the transfer phase with the predicted slope change between phases. You get a normalized directional measure, and we call that measure a transfer score. And with this score, when the transfer score is 1, you get a perfect transfer. When the transfer score is 0 or below 0, that means you didn't really get transfer. And when the measurement is between 0 and 1, you're getting a suboptimal transfer. So in our study, we basically measure transfer scores in 2 coin task experiments and to answer 2 questions. So the first question we want to ask is how cognitive loads affect the use of Bayesian strategy. And the second question is whether people can truly transfer outside past experience. And in order to verify the robustness of our findings, for each experiment, we also run a self-replication study. So the reason we want to test the effect of cognitive load in the first experiment is actually the explicit Bayesian computation itself by nature is cognitively very demanding. Actually, there was one past studies, they used the coin task to test transfer when people learn two locations priors at the same time, and they didn't find any transfer. So they drew the conclusion saying, okay, maybe it is because the cognitive load of learning two priors are just too overwhelming. So people resorted to non-Bayesian strategies. However, our group find that this conclusion might have been drawn a little bit too quickly. So one other thing we want to do is suppose if it is truly because the cognitive load of learning two priors at the same time causes the use of non-Bayesian strategy and cause you to have an observation of no transfer, then if you ask people to learn one prior at one time, that might rescue you, that might encourage you to use the Bayesian strategy again, and you will see transfer. So that's what we did. So basically, we use coin task, and we use two likelihoods and two priors. For the learning task, we use two orthogonal pairs of prior and likelihood pairs. And then in the transfer phase, we use one prior paired with both likelihoods. And the difference, we divided people into two groups. The main difference is how they receive the trainings. So for the serial group, they basically learn the prior likelihood pairs in a blockwise way. And for the parallel group, just like what people did in the past, they learn the different prior and likelihood pairs in an interleaved way. And our predict is if what they previous study recognizing the non-use of Bayesian strategies caused by simultaneous prior learning is true, then we should observe a better transfer in the serial group than the parallel group. And then for our discovery studies, so we have 40 participants for each group. And then for the validation study, replication studies, we have 80 participants for the serial group and 79 participants for the parallel groups. So let's first still go back to look at the slope. Apologies for this is a very big graph, and then let me walk you through this. So basically, let's look at the discovery set. So for the slope data in both the learning phase and also the experience prior likelihood combinations in the transfer phase, basically people are Bayesian, even though they weight the likelihood slightly more than they're supposed to be if they are Bayes-optimal, and we didn't see any phase difference between these two types of trials. But when you look at the newly encountered trials in the transfer phase, they still maintain the prior effect. They still take the priors into account, but they lost the effects of likelihood. And this is exactly what the previous group observed, and actually we saw very consistent finding between the discovery and also the validation set, and the findings are the same between the serial and the parallel groups. So for the previous studies, they basically drew the conclusion at this point, saying because there's no likelihood in the transfer new trials, there's no transfer. But now let's look at the transfer score. So here I basically merge the trials with different prior likelihood combination, because in the transfer score we didn't see any difference between different prior likelihood combinations. But look at the transfer score. In both discovery and validation set, we can see there's a transfer score that's significantly bigger than 0 and also significantly smaller than 1, which means we indeed observed the effect of transfer even though they are not optimal. And importantly, we didn't see any difference between the serial and the parallel learning group in both discovery and validation set. So our ancient summary of the experiment 1 is in the coin task, people's behaviors are indeed Bayes fashion, even though they have an over-reliance on likelihoods, and they have significant but suboptimal transfer using the transfer score, and we didn't find any group difference. So the short conclusion is we consider, looks like combine the finding of our study and the previous study, the negative transfer from in the previous study is more likely to be caused by imperfect prior likelihood estimation rather than a use of non-Bayesian strategy. Now come to the second study. So here, as you can tell, the main motivation to perform this study is truly try to differentiate the explicit Bayesian strategy versus the Bayesian approximator. So basically, as I have mentioned before, if you are an approximator, you will have better transfer inside the range of previous experience, while if you are an explicit Bayesian learner, you should have equal levels of transfer, whether it's inside or outside past experience. So the way how we did the experiments, in the transfer phase, people will encounter one prior paired with 3 different narrow, median, and wide likelihoods. But the way how they differ is how they differ the experience in the learning phase. For the interpolation groups, basically, they learn the prior paired with narrow and wide likelihood during the training, which means when they, in the transfer phase, the newly encountered combination is basically a likelihood sitting within their past experience. That's why we call it interpolation. And then in the extrapolation group, they basically encounter the narrow and median likelihood, which means for the newly encountered wide likelihood that was outside their past learning experience. So we will have different prediction based on whether they are approximation, approximator, or they are truly explicit Bayesian learner. And for the discovery set, we have 35 for interpolation, 40 for extrapolation, and we have 82 participants for each group in the validation set. So again, look at the slope data only. Again, the discovery set and the validation set, their data are extremely similar. So the main things I want to tell you is basically for both interpolation and extrapolation groups, and also for both learning and transfer phase, the likelihood effect, which means the Bayes fashion behaviors persist. And also, if you only draw a conclusion based on this, you will say it looks like they have a very similar levels of transfer only based on slope data, but let's look at the transfer score. So for the discovery set, basically, in the transfer score, again, we observe significantly bigger than 0 transfer. And then for the transfer score, when it's compared to 1, for the interpolation group, they have a marginally significant, slightly below than 1. But for the extrapolation group, they have a very significant difference between 1 and the transfer score of the extrapolation group. And looking at the validation set, again, we observed a significant transfer, i.e. a bigger than 0 transfer score. And now in the validations set, we observe that the transfer score in the interpolation groups are significantly bigger than the transfer score in the extrapolation group. So overall, for the interim summary of the experiment 2, again, we see in the coin task, behaviors are best fiction, but still there is an over-reliance on likelihoods. And using the transfer score, we observe significant but suboptimal transfer. But importantly, we saw better transfer in the interpolation group than the extrapolation group, which is more in line with the Bayes approximation than the explicit Bayes observer hypothesis. So overall, taking the 2 study groups, at least within the boundaries of the current studies that we carry out, we can see it looks more like the behaviors are supported by the Bayesian approximation strategy rather than an explicit Bayesian performance Bayesian computation. And importantly, we show that using a transfer score to quantify knowledge transfer is a more effective way to disentangle the strategy used for Bayesian inference. And also because the transfer score itself can be used across different experiment setting, whether it's different setting within the coin task or outside the coin task or different domain, cognitive domain. So that means we can apply this kind of approach to study and in the future to advance our understanding how we perform probabilistic inference in human. So that's basically the talk. And in the end, of course, I want to send thanks the my host PI, Ma Cha, and also thanks Chen, Li, Yuan Yuan, and Sarah for their implementing and collect such a nice data set, and also want to say thank you to everybody in the lab and everyone who is here, to take part. Thank you.
Thanks, Sophie. That was a fabulous talk. I'm very biased. Questions?
Thanks, Sophie. You stressed the importance of transfer as being the sine qua non for Bayesian, for Bayesian inference. For me, the issue has always been optimality, and you've acknowledged that there has been a kind of aggravated Bayesian problem of suboptimality.
Yep.
Now, and that's been so back as far as the 1960s, when people were start looking at the ideal observer hypothesis of signal detection theory. Your response to that is to say, well, not formally Bayesian, but some sort of Bayesian approximation. And I think in that, you want to try and keep the essence of Bayes, but move to something which is possibly a little bit easier to compute. And for me, the real question is, what are the representations and what are the computations?
Exactly.
Representations. You can't answer why people are suboptimal within the Bayesian framework. You need to kind of talk about representations and computations, and people for a long time have talked about just the implementational complexity of the full Bayesian computation. So from the point of view of the kind of cognitive representations involved in Bayesian approximation, what do you think the brain is doing and needs to do in order to be able to produce the behaviour you've observed? So what would be the sort of the computational basis of the Bayesian approximation that you think is actually going on in this task?
Yeah, I think that's the holy grail of everybody who is interested in the Bayes model's behaviors. I kind of feel like I'm truly not fully in the position to answer these questions. We are only just at the very beginning. For example, we don't exactly know whether it is truly an approximation representation with the posterior that being represented in the brain, or it is something like a combination of something which emulate prior and likelihood and put them together.
Just be a little bit more specific.
Yes.
But there are some simple little kind of cheap and plausible computations that the brain could implement that gets you along the way. So strengths are proportional to likelihoods in many settings. Normalisation across a range of competing representations will give you marginalisation, which is the essence of the Bayesian computation. So I'm wondering whether those sorts of cheap, easily implementable in a neural sense computations will give you the kind of approximation that you need to produce the Bayes-like but suboptimal behaviour.
Yes, for that I think I can only say that with the intellectual inputs from many other researchers. They were many hypotheses about how this is done. So, for example, like the normalization, that's definitely one thing you talk about. And they were actually papers talking about the impossibility of marginalizations that we call